What I remember most, I think, is about the ambulances that were lining up to pick up our patients. There was this constant stream of ambulances. The roads were supposed to be closed so the ambulance could have a direct path to Meritus without traffic lights. It was amazing to see how coordinated that effort was and how smoothly it went off.
Seeing the ambulances coming up with our patients, and it still gets me. All of the work that we had done to make this happen and how smoothly the patients were transitioning onto their new floors and their new areas.
There was a constant flow of 100+ patients, ambulance after ambulance after ambulance. That was a memorable event.
I stayed at Washington County Hospital until the very last patient got moved over, and then probably about an hour after that, with a lot of other folks walking the building, just sort of sharing memories, things like that. I had been an ER nurse in that building for many years, so it held a special place. And then actually going to be the last time I walked the halls of that building that I'd walked so many times before. I sort of took it in, I took a few pictures for nostalgia's sake, and honestly, once I left the building, I tried not to really think much about the space any longer and just focus on all the great exciting stuff we were going to be doing over here at Meritus.
One of the memories I have is looking up at the old Washington County Hospital and seeing a group of nurses who had just transferred the last patient off of their unit, and they were waving out the window. I think about somebody saying goodbye to an old friend. Because those are staff that had been really the place that they came to work for many of them their entire lives.
I didn't realize how emotional we were going to be that day. I actually brought the last patient from Washington County, and it wasn't planned. It was just one of these things. They were like, okay, Lisa, you go with this baby. And we walked in the door with the baby, and there was all these people there, and it was, people were applauding and everything. Brought the baby into the nursery, and it was just so unreal.
A lot of us had been there a long time, so we were kind of sad to see that institution, that building that we'd worked in, close. But we were excited. We were excited for the future. We were excited to do new things. And so the excitement outweighed the little bit of sadness that we felt, because we had a lot of good memories there.
The one thing that was funny is there was actually a woman waiting outside the emergency department that was in labor, and she wanted to be the first woman delivered at the new hospital at Meritus Medical Center. And so as soon as we opened, she came in, and of course, our procedure is to triage them if they're in labor and send them right up to labor and delivery, but she was our first patient in.
The old hospital was wonderful. Everybody has a lot of great memories there, but this facility is just so head and shoulders above that facility. It's a wonderful place to work, and we're really lucky to have it.
When you think about technology, and I know in the cancer program we're always focused on the room for our technology and equipment. And so, you're not fitting that into that previous space. You were really able to design bigger rooms, bigger spaces for the OR, for the critical care rooms. Those types of spaces just weren't originally designed to handle modern healthcare technology. So when you have a new building, that really makes a difference.
There are so many incredible accomplishments, but by far my favorite and one that I'm most proud of is being named a magnet organization.
I think there's been a lot of accomplishments over the last 10 years. For me, probably the one that stands out most is the magnet designation.
We did this little thing called EPIC, where we brought in a whole new electronic health record system. That was a huge, huge lift, and so important to delivering seamless care and continuous care to patients.
The introduction of the minimally invasive robotic surgical procedures is just amazing. What we can offer now. We can keep folks that might have gone down the road, keep them in town, keep their families close to them, and give them better outcomes.
The residency program is one of our beauties also, of course. It started 2 years ago. We have a family practice residency or so. And our hope is that we give them such a good experience that they stay with us over here. Even if a few of them, they decide to stay, that will be a big plus for us.
The staff that we have, many of them are furthering their education beyond just having their bachelor's in nursing, and that's being encouraged. And I think that is a big plus for the community and the hospital system.
It's a welcoming place, and I feel so much pride in having been part of that move day and in being here actually 10 years later.
For the Washington County residents, this new hospital was a huge upgrade.
This facility will rival any facility in the state. And for us to have it here in our own backyard, it's a tremendous asset to the people that live here.
It was important for our community because of preserving some of their history and then also moving forward to the future. And now we're celebrating the 10 years, which is fabulous. The time flies. You know, I'm just glad to be part of it, and looking forward to the next 10 years.
Hi everyone, it's Malik Joshi, and I am so excited to be able to celebrate with you the 10th anniversary of Meritus Medical Center. This is a special place not just because of the beautiful space and the incredible services we provide, but it's because of the people. Thank you for creating this incredible campus and taking care of our community. And I know we will continue as we look forward to the next 10 years in our 2030 bold goals to improve the health status of our region. Thank you.